Can start, ma'am.
Yeah, so I'm ready. You all can start.
1 second. Yes, ma'am, we start. So, good evening. Okay, yes, ma'am, it's live online, ma'am. Okay. So, good evening, everyone. Hope all of you are safe. Sorry. Okay. Good evening, everyone. Hope all of you are safe. Being it our very first event ever organized, we feel immensely proud and extend our warm wishes on behalf of IIMS Chettinad Hospital and Research Institute to welcome you all. We feel very honored in welcoming our speaker for today's webinar, Dr. Namita ma'am. We're happy to have you, ma'am.
Thank you.
Dr. Namita CS is an obstetrician and gynecologist practicing at Apollo Clinic, Bangalore. She has previously been a senior resident at St. John's Medical College Hospital and has presented various posters and papers at state and national level conferences. She is very passionate towards teaching OBG and is also the founder of OBG Tastic, an Instagram page for teaching OBG in a fun way with handwritten notes and read. This very passion this very passion for teaching has won her the Best Teacher Award in St. John's Medical College for the year 2019-20, elected by the students. She has also conducted Skills Lab for MBBS and postgraduate students in OBG. We're very happy to have you, ma'am.
Thank you so much.
I also want to convey my heartfelt gratitude to Professional Helps in helping us organizing this event. Thank you, Professional Helps. You have the host.
Yeah, 1 minute. Gopika, you can start.
Am I visible?
Yes.
Okay. So good evening, ma'am. We would like to start this session by asking you that what is the importance of this World Breastfeeding Week and why have a week fully been dedicated to breastfeeding?
Hi, everyone. I'm very happy to be a part of this event. So thanks to all the organizers who have played a small or a big role in making this happen. So let's jump into the topic right away. So today is August 1st, the first day of World Breastfeeding Week 2021. So why are we celebrating a whole week dedicated to World Breastfeeding? So I'll tell you a little bit of a history so we understand why this whole week is dedicated to breastfeeding. Right from the years of 1979, there were a lot of legal issues against powdered milk formulae that were being advertised and that were being distributed at large to all the mothers to feed their babies, as in to reduce the breast milk being given to the babies. A lot of pediatricians were against this practice. They were conducting a lot of legal cases against these companies. Over a few years, making the long story short, I'll tell you that World Health Organization, UNICEF, that is United Nations Children's Emergency Fund, lot of government policy makers and lot of other government organizations came together in 1990 and signed a declaration called the Innocenti Declaration. So what does this declaration state? It said that every country should have a national breastfeeding policy. It gave some 10 important steps to ensure successful breastfeeding. The declaration also gives strict and stringent rules against the formula milk companies, and they have to publish or print about the benefits of breast milk in their packets. Also, it also had rules for working mothers so that they could also pump breast milk and feed the baby. So these were few of the regulations that came out in 1990 to promote, protect, and support breastfeeding. The World Alliance for Breastfeeding Action was it came into picture in 1991, and it from then has a yearly theme for World Breastfeeding Week. So the theme for last year, that is 2020, was Support Breastfeeding for a Healthier Planet. And the theme for 2021 World Breastfeeding Week is Protecting Breastfeeding, a shared responsibility. So it means that breastfeeding is a responsibility of the mother, their family, the healthcare providers, and the whole world in general. Why are we emphasizing so much on the importance of breastfeeding? Because it can improve the health of babies all around the world if we encourage and improve the awareness of breastfeeding. Hence, the whole week dedicated for breastfeeding awareness.
Okay, ma'am. So ideally, when can the mother start feeding her baby for the first time?
Okay. So as soon as the child is born is the ideal time to breastfeed the baby. The World Health Organization states that all babies must be put on the breast for breastfeeding within 1 hour after birth. Correctly said that 1 hour is known as the golden hour. I would like to say that liquid gold must be given to the baby in the golden hour, which is the first hour after birth. But there are a lot of practical difficulties that we face. So you know that children, that is babies, can be born via vaginal or cesarean section. And there are various situations where the mother can be fit and healthy, or she can also be sick and she can have some complications. So it varies with each and every situation. So coming to an ideal situation where the mother has a vaginal birth and the child is born via vaginal delivery and the baby cries immediately after birth, ideally the baby is placed on the mother's abdomen for skin-to-skin contact for the best warmth that can be provided to prevent hypothermia. Skin-to-skin contact is the best thing that the baby can get immediately after birth. There is a new concept called breast crawl. I think you all would have heard of it. Breast crawl is something that the baby instinctively does when the baby is placed on the mother's abdomen. It's eye level at the level of the nipple area complex or the breasts of the mother. There are a lot of sensory, motor, and central pathways that are activated in this newborn child, and it slowly crawls or moves towards the breast and it starts breastfeeding on its own. On an average, all the babies have this breast crawl initiated within 30 to 60 minutes. With help, if the baby is placed directly on the mother's breast, innate reflexes of rooting, sucking reflex, and swallowing reflex get activated, and the baby starts breastfeeding immediately. This is in case of a vaginal delivery where the baby is born healthy, pink, and cries immediately after birth. In case of a cesarean section, because of the aseptic precautions that are followed in the operation theater, the guidelines are that the baby must be put on the breast for breastfeeding within 1 hour after birth or maximum within 4 hours after birth. If the mother is fine and doesn't have any complications, she can start breastfeeding immediately. But in case of postpartum complications of the mother, or if she's sick due to any other complications, the best option is to express the mother's milk and take it to the baby, and the caretaker can feed the baby. So ideally, if you ask me when to start breastfeeding, I would say immediately after birth.
Okay, ma'am. So while giving the babies its first feed, so what are the care and prep taken by the mother?
Yeah, that's a great question, because we have something known as colostrum. The mother produces a special type of breast milk for the first couple of days. That is known as colostrum. It is a deep yellow serous fluid which is alkaline in reaction, and it has higher specific gravity, more proteins, more vitamin A, more sodium, chloride, a lot of large fat globulins, immunoglobulins like IgG, IgA, IgM, lactoglobulin, all other enzymes which are present in colostrum. The only difference is that it has less carbohydrates, less fat, and less potassium as compared to the actual breast milk. So why do we need to know all this about colostrum? As I said, colostrum is produced in a very small quantity in the first 2 or 3 days, and that is enough to satisfy the hunger and other needs of the baby. It has large fat globules which act as a laxative, and you all know that the first stool that the baby passes is a thick greenish stool called meconium, and the fat globules which act as a laxative help in removing the meconium when the baby passes its first stool. Also, it has a lot of immunoglobulins like IgG, IgA, IgM, which prevent any infection that the baby is exposed to in its first few days in the world. So this is the thing that the baby consumes in the first 3 days. So what are the care and precautions that the mother must take when she's feeding the baby? Always, when you are practicing in your postnatal wards, you have to ensure that the mother and the baby are in a comfortable position to breastfeed. The baby will immediately show signs of readiness to breastfeed. As I said, once we place the baby on the mother's abdomen for skin-to-skin contact, you will see that the baby slowly looks around, the baby slowly moves, and the baby searches and its mouth will open. All of you who have witnessed deliveries will be able to relate to whatever I'm saying. The baby will actually open its mouth and search for the breasts for breastfeeding. So once the baby shows these signs of readiness, a correct position and a correct attachment is given with the help of the nursing staff or other healthcare providers present at the delivery, and the baby is put on the breast for breastfeeding. And the other alternate breasts are also given for breastfeeding, one after the other. And we have to observe that the baby has slow suckling with pauses in the middle, and that is how the baby sucks breast milk normally. One more thing that we have to very importantly remember for the first feed is that no pre-lacteal feeds must be given. When I say pre-lacteal feeds, I mean no sugar water, no other substances other than breast milk to be given before placing the baby to feed colostrum. But in special situations, there can be situations where the mother is unfit or the mother is being shifted to a high dependency unit for certain medical complications. In that way, the expressed breast milk is given, and hygienically in a clean sterilized cup or a spoon or a palade, the expressed breast milk is fed to the baby with the caretakers or the other healthcare providers. So these are the care and the precautions that the mother and the healthcare providers must take for the first feed of the baby.
Thank you so much, ma'am. That's very so informative.
Thank you.
So we all know about the fact that there is a very aggressive marketing of breast milk substitutes around us, and which is a major barrier to improving newborn and child health worldwide. So this tells us how important breastfeeding is for the baby's health and its growth. So ma'am, would you like to share some light on what is exclusive breastfeeding and how is this method beneficial for the baby?
Great. So this question is at the perfect time where a lot of breast milk substitutes are being marketed, and let us shed some light on exclusive breastfeeding, as you said. So EBF is the abbreviation for exclusive breastfeeding. So if you ask me, I will tell you that it is early and exclusive breastfeeding, EBF. All right. So what is the definition of exclusive breastfeeding? It is when only breast milk is given to the baby and no other foods like water or any other substitutes, but the only allowed substances given along with breast milk is few medicines which are indicated and vitamin drops. This constitutes what is exclusive breastfeeding. So the WHO guidelines state that exclusive breastfeeding must be given for a minimum of 6 months, 180 days of exclusive breastfeeding, and the mother should continue breastfeeding for a minimum of 2 years and beyond, along with age-appropriate complementary foods. So after the completion of 6 months, age-appropriate complementary foods must be started and breast milk be continued till the mother and the child are ready to wean off. There is a statement that is said to educate the mothers. We always say food before one is just for fun. So that means the complementary food that is given for the baby before the age of 1 year is just for fun, because the primary source of nutrition for the baby is from the mother's breast milk. So why are we emphasizing the importance of breast milk so much? Because it is the ideal food and it is rich in all the nutrients. When I say all the nutrients, I mean it has carbohydrates like lactose, which are very easy on the gut, easily digested, and it also helps in the synthesis of the gut flora and also vitamin B synthesis. It has richly loaded proteins like lactoglobulin and lactalbumin, and it is low in casein. In contrast to cow's milk, which is very high in casein, and it is very difficult for the baby's sensitive gut to digest it. Lactoglobulin and lactalbumin are very easily digested. It has vitamins and minerals in the required quantity for the baby to digest. The electrolytes like sodium, potassium, calcium, and chloride are at adequate or a little low levels compared to other animal milk, because the baby's kidney is still in the developing stages. The osmotic load of the breast milk is very low on the kidneys and it is easily digested and excreted. The breast milk is loaded with fat globules, which are easily emulsified in the gut and easily digested. Breast milk is rich in omega-3 fatty acids, long-chain omega-3 fatty acids, which are very important in myelination and helps in neurological development. So, in a nutshell, I'd like to enumerate all the benefits of breastfeeding for the baby. As I told you before, it is the ideal food for the baby, easily digested, easily excreted. It is readily available, does not require any heat treatment. It is readily available at body temperature. It is very affordable. No cost is involved in producing breast milk. And the other advantages are that it has a lot of immunoglobulins, IgG, IgA, IgM, which help in combating infections and other infectious diseases. It has a laxative property too. Lysozymes and lactoferrins are a few substances that are present in breast milk, which also help the baby to fight infections. A few hormones and neurotransmitters like serotonin are released, which help in calming the baby and making the baby sleep better. Few vitamins are present in in breast milk, which supplement the baby and reduce the incidence of scurvy, reduce the incidence of rickets. There are a few advantages in long term if we feed the baby. What are the advantages? It reduces the incidence of respiratory tract infections. It reduces the rate of diarrheal diseases. It reduces the rate of sudden infant death syndrome, also known as the crib death. It reduces the rates of asthma later in life. There are a few diseases like non-communicable diseases which are reduced if breast milk is given for the baby. What are those diseases? Type 1 diabetes mellitus, type 2 diabetes mellitus, childhood obesity, overweight. Also, there are a few studies that say that children who are breastfed go on to perform better in intelligence tests and they have better IQ. We should also remember at this juncture that there are studies that show that formula-fed babies have higher incidence of childhood obesity, overweight, type 1 and type 2 diabetes mellitus, allergy or atopic dermatitis, and also incidence of Crohn's disease and ulcerative colitis, which is completely absent in breast milk babies as per the studies, because breast milk is non-allergenic, ideal food, easily digested, and is a powerhouse of nutrients.
So, ma'am, what about exclusive breastfeeding in twins and preterm babies. So is it required to supplement it with top feeds right after their birth due to extra nutritional requirements or something?
Yeah. So this is the most common question that um, uh, parents or to-be parents of twins would usually ask us, and we see that twins are usually born with, not always, but most often they are born as low birth weight babies or late preterm babies. So we should remember that the magic of this liquid gold is that the mother produces breast milk according to the demand and the need of the baby or babies, if it's multiple births. So the composition of breast milk changes according to the need of the baby. The breast milk composition will change according to the hunger, according to the infection, or according to the disease corresponding to what the baby is suffering. So there is only advantage in exclusively breastfeeding the twins or the preterm babies, because the advantages are manifold, right from immunological benefits to neurological benefits to nutritional benefits, and most importantly, psychological benefits for the mother as well as the babies. It is also seen that if breast milk is fed to the preterm babies, there is a decrease in the incidence of hyperaminoacidemia, decrease in the incidence of metabolic acidosis, and also decreased azotemia. That is, it reduces the levels of blood urea nitrogen products in the blood. So overall, breast milk is only advantageous for preterm babies and twins. At this juncture, I would also like to tell you that pediatricians and neonatologists and lactation consultants will work in association for formulating the infant feeding protocols for a particular preterm baby or twin baby. So there will be a lot of customization for particular babies, but overall, exclusive breastfeeding is more than enough.
Okay, ma'am. So you have already shed light on the benefits of breastfeeding on on the baby. So would you like to share some benefits on the mother?
Right. So we had an exhaustive list of benefits of breastfeeding on the baby. So now let's jump into the benefits of breastfeeding on the mother. First and foremost, I would like to tell you that it has a profound psychological benefit on the mother. When the mother is breastfeeding the baby, directly breastfeeding the baby, she is indirectly giving skin to skin contact. She's gazing at the baby. There is bonding and there is a lot of exchange of love. There is cuddles and everything that goes on when the baby is breastfeeding. That has a profound psychological benefit on the mother. It helps her to heal her postpartum journey better, and it reduces the incidence of postpartum depression. That is the most common and the most important benefit of breastfeeding for the mother. What are the other benefits? It helps in her weight loss journey. A mother on an average produces around 500 to 700 ml of milk per day, and she burns around 500 kilocalories per day. And that is equal to a very high intensity workout. And hence, she loses a lot of weight during her journey. And this is the reason we would always advise breastfeeding mothers to have a well-balanced, nutritious diet. What are the other systemic benefits of breastfeeding? So when the baby suckles on the breast to drink milk, there is release of this hormone called oxytocin. It is a uterotonic hormone. It causes the uterine contraction, and the uterus involutes or comes back to its pre-pregnancy size faster. So when the uterus involution is hastened, it reduces the incidence of postpartum hemorrhage, and therefore in long term, it reduces the incidence of blood loss or anemia. The other advantages are that it reduces the incidence of osteoporosis, it reduces the risk of type 2 diabetes mellitus, heart disease, hypertension. All these non-communicable diseases, that is the lifestyle diseases, are reduced because of breastfeeding. It also reduces the incidence of life-threatening cancers like ovarian cancer and cervical cancer by breastfeeding. And another important advantage of breastfeeding is that it acts as a temporary contraceptive. by inducing something known as lactational amenorrhea. So again, this is an exhaustive list of the benefits of breastfeeding for the mother.
So breastfeeding is both beneficial for the baby and the mother.
Yes, right.
So the most common position of breastfeeding is the cradle hold, and there are many other different methods of position of breastfeeding. So out of these all, which is the most advisable position for the baby? And it would be great if you could please demonstrate some of these methods, ma'am.
Yeah, sure. So as you said, cradle hold is the first position that we all picture when somebody says a mother is breastfeeding her baby. Yes, what you said is perfectly right. But the thing here is there is no particular perfect position. Whichever position is comfortable for the mother and comfortable for the baby is the position that the mother and baby should breastfeed. But yes, breastfeeding it is never always a smooth journey. There are a lot of hurdles that the mother and the baby should cross, like infections of the breast, mastitis, blocked ducts, pain due to a cesarean section wound, episiotomy wound, that the mother is not able to sit and breastfeed properly, so on and so forth. So there are a lot of positions that we can teach as healthcare professionals to our patients in postnatal wards. So I would urge all of your students to listen to this carefully, because next time when you're doing your postnatal rounds or in your postnatal postings, if a mother is struggling to breastfeed, you can go and you can yourself teach her how to breastfeed the baby with a different kind of a position to make her feel comfortable. So I'll be using a mannequin and I will be showing you different positions in which we can teach the mother to breastfeed the baby. So this is for your teaching purposes, so that you can learn and you can help the mothers in your postnatal wards. So there are different names that you can give for different positions. The first try that the mother will give for trying to breastfeed is known as the laid back position or the reclining position, also known as the biological nurturing. Why is it called so? Because in this position is where the breast crawl that we discussed earlier happens. So in this position, after delivery or after cesarean, the mother is lying down reclined on her bed and she's at an angle to her supine surface. There are a few pillows that are supporting her back, and a caretaker helps her to feed the baby by placing the baby on her chest or her abdomen, and she is not able to hold the baby. So that is the reason it is known as laid back or reclined breastfeeding. So as you said, coming to the next position, which is known as the cradle hold. This is the classic position which everybody picturizes when somebody says a mother is breastfeeding the baby. So what is this position? The mother is sitting upright with her back rested against a surface and a pillow to support her back. She has a pillow on her lap to support her baby and also her arms. So the baby is placed supine on the arms and the baby's head is supported on the forearm of the mother. And the baby is turned towards the breast and the baby is initiating breastfeeding. So this is known as the cradle hold. Also, when we teach the mother, we say that the baby's tummy should touch the mummy. So tummy to mummy hold. Okay, so this is known as the cradle hold. So there is something known as the cross cradle hold. So the cross cradle hold is where instead of supporting the baby's head with the forearm, the opposite arm of the mother comes into picture and supports the baby's head. This is similar to cradle, but because the opposite arm is used, it is known as the cross cradle hold. There is another hold known as the football hold, the rugby ball hold, or a underarm hold or a clutch hold. So you would have seen babies, you would have seen that the women carry clutches over here as a purse, right? So that is the reason this is known as the underarm hold or the clutch hold, where the baby is placed on the lateral aspect of the mother, supported with the help of a caretaker or a pillow. And the baby head is supported with the arms and the baby breastfeeds from the lateral aspect. This is known as the rugby ball hold. Now, why is this position used? If the mother is having a painful cesarean section wound, or if she's having a painful episiotomy and she's not able to balance the baby over the abdomen due to pain, so she can use this hold to breastfeed the baby. Next, a very useful and easy position for mothers to breastfeed lying down, especially for night feeds, is that the mother lies down and places the baby between her trunk and her arm. So both mother and baby are lying down and the baby breastfeeds lying supine to the mother. This position, when we teach the mothers, we say belly to belly, because the mother's abdomen and the baby's abdomen are in contact. Next, coming to another hold, which is useful for twins. It is double rugby ball hold. So one baby is placed here and the other baby is placed here. And this is known as the double football or the double rugby ball hold. There is also another position called upright hold or the koala bear hold. This is useful for older babies where the neck is stabilized and the baby is able to sit. So the baby is placed sitting in front of the mother and the baby breastfeeds directly. So these are few positions. There are few positions in cases of mastitis or in cases of blocked ducts where the mother would use the help of gravity and bend over the baby and feed breast milk so that the blockage in the blocked duct will get relieved. So these are all important positions along with the pathologies in which it is used. So all these positions will help you to teach a postnatal mother how to establish breastfeeding. Also remember, at the end of the day, whichever position the mother or the baby are comfortable, they can continue breastfeeding. So this is about the positions.
Okay, ma'am, that was a remarkable explanation.
Thank you.
So very often mothers complain of not having adequate milk production. So what can be done to help such mothers and what may be the cause of this?
Right. So when you say inadequate breast milk production, it is kind of something known as lactation failure. So let us talk about factors that involve in successful successful lactation. So if the mother and the baby are in a suitable position with a good attachment, with a good latching and good nursing technique, the lactation is always successful. Another important thing to ensure that there is successful lactation is that no pre-lacteal feeds should be given to the baby. Okay, so in case of successful, in case of inadequate breast milk production, if the mother is complaining, this is the most common complaint that we see in a postnatal ward. When you go for morning rounds, evening rounds, the only thing the mother will tell you is my milk is not enough. So you should always encourage her. You should always tell her to have unrestricted breastfeeding with short intervals. She should have a well-positioned infant and a well-positioned posture to breastfeed her baby. You should give her practical support, as I told you before, and you should give her adequate emotional support. But there are actually a few conditions where breast milk production is not enough. So what are those conditions? If the mother is having excessive stress, anxiety, insecurity, or if she's having a past history of lactation failure, so she's scared. She's scared that again, this time she won't be able to produce milk. If she has had an exhaustive, prolonged vaginal delivery, or if she's had a painful cesarean section, or if she's had an ICU admission right after delivery, or if she's had some other intraoperative complications or intrapartum complications or postpartum complications, she is not able to breastfeed. If she's not able to breastfeed the baby initially after birth, the supply will automatically reduce. So there are a few factors regarding the fetus, that is regarding the neonate, where there is a reduction in breast milk supply. What are those things? If the baby is low birth weight, if the baby is preterm, or if the baby has a few respiratory tract infections, the baby is not able to suckle on the breast effectively. So when the baby is not able to suckle on the breast, there is less demand and the supply automatically reduces. Sometimes in a little older babies, there can be nasal congestion, or the baby's stomach can be full with swallowed air, or if the baby may not suckle frequently, or if there are congenital anomalies like cleft lip or cleft palate, the baby is not able to efficiently suckle. And that is the reason the breast milk supply will reduce. So as healthcare workers, as people, as doctors, as healthcare providers, who we meet them daily in the postnatal ward, so we are supposed to teach them and educate them about all these factors. So as I told you, the mother and the baby should be in a comfortable position. Next, coming to the attachment. So we should teach the mother about a good attachment. You will ask me, what is a good attachment? That means the baby's mouth is wide open and the whole of the nipple areola complex is inside the baby's mouth, and not only the nipple. The whole of the nipple areola complex should be inside the baby's mouth. The baby's chin should touch the breast such that the baby's chest and the mother's chest are in close contact. We should make sure that the baby's ear, the baby's shoulder, and the baby's hip all are in a straight line and not twisted. Okay. And once the baby is in such a position, the whole of the nipple areola complex is inside the baby's mouth, and the baby's lower lip is everted or turned outwards. And slowly the milk transfer or the milk letdown happens. So to encourage a better letdown, the mother can hold her breasts with a C hold, and she can promote a good latch. Once the latching on has happened, there is a latent period of around 60 to 120 seconds, after which the milk starts flowing into the baby's mouth. You should know that 90% of the breast milk is drunk by the baby in the first 5 minutes. So if a mother tells you that the baby is drinking milk only for 5 minutes, you're supposed to reassure her that the baby is well fed and there is nothing to worry. There is a concept of foremilk and hindmilk. So foremilk is basically having more water. Breast milk is basically 89% of water. So foremilk has more of water content, and it is for saturation of the thirst of the baby. Till around 6 weeks postpartum, the mother will produce a distinctive foremilk and hindmilk. Hindmilk is something that is rich in calories and rich in fat. So that helps to satisfy the satiety of the baby, that is the hunger, will get satisfied. So the mother has to ensure that the baby feeds completely on one breast, and then she can move on to the other breast. She has to ensure that there is unrestricted feeding at short intervals. There is no restriction on the number of feeds or the duration of feeds. The baby should breastfeed in the day as well as in the night. Minimum, there should be more than 8 feeds in 24 hours. So at the early days after birth, we should practice rooming in. That is, the mother and the baby should be in the same room for 24 hours. And the baby should be given as much skin to skin contact as possible, such that there is increase in production of breast milk. So if the baby is not able to suckle well, the demand reduces, and there is no good latch on, and there is no milk transfer. So what happens? All the milk is accumulated in the mother's breasts, and that leads to breast engorgement. And this breast engorgement leads to distortion in the breast parenchyma, leading to reduce in milk, therefore lactation failure. So the take-home message for this question is unrestricted feeding at short intervals with a good attachment and a good latch will ensure a good demand and supply, leading to adequate milk production.
Okay. So in many countries, including India, Iraq, etc. There are many countries. Very often, babies are given sugar water, flick sweets, camel thorn, etc., and just within their birth. So, what will be the effect of this routine?
Yeah. So as you said, it's not only in India, it's all over the world, right? So the problem here is, let's concentrate on India right now. We have a lot of religions and we have a lot of deep-rooted customs and lot of religious beliefs. And it is very difficult by just one doctor or one healthcare professional to, break these beliefs. So it involves a group effort by all of us, and only intelligent, factual counseling to each and every one will help to debunk these myths. So again, I will tell you a strict rule: no pre-lacteal feeds. The only thing that is supposed to be given to the baby at birth is colostrum, that is breast milk. So I'll tell you what is the problem associated with this. So you told me about sugar water, right? So I'll just give you an example. 2 spoons of sugar water are fed to the baby after birth because of the myth that if the baby eats something sweet or sugar at birth, the whole life will be sweet. So when the baby is given 2 spoons of sugar water, baby's stomach is the size of its own fist, which will be this tiny. So the 2 spoons of sugar water will be drunk by the baby and the stomach of the baby will be full. So if the baby is put on the breast, the baby is not hungry. So the baby is not going to latch on the breast and the baby is not going to take breast milk. So there is a demand and supply concept, as we discussed earlier. So the baby is not demanding breast milk, the mother is not going to supply breast milk, and there is resultant lactation failure. So we have to make sure that no pre-lacteal feeds are given. What is another problem with these sugar water kind of substances? The sugar is impure, the water is most often impure. So the gut of the baby is so sensitive. It is not able to take such a high osmotic load in the form of high sugars and impure water. As a result, the baby gets infections, and there is a very high rate of infant morbidity and mortality if the baby is not given breast milk. So at this point, I'd like to remind you, when we discussed earlier about the benefits of breast milk, I told you breast milk has a lot of enzymes, antibodies, and a lot of substances to reduce infection. So no kind of sugar water will give antibodies, enzymes, or things to reduce infection. So it is very clear that no pre-lacteal feeds should be given for the benefit of the health of the baby, because breast milk has all the nutrients, all the water, and all the enzymes and antibodies that are required by the baby.
Okay. Hope everybody take it to their mind.
Yeah.
So, ma'am, could you please share something about how can the mother ensure that her baby is being fed adequately?
Right. I told you, or in postnatal rounds, the first complaint that the mother will say is milk is not enough. This is the second complaint. They will say, I'm producing enough milk, but my baby is not drinking. Okay, so this is the second most common thing that you all will see in your postnatal round. So you should first reassure the mother. A great amount of benefit is there when we emotionally support the mother. That is one thing I always emphasize on. And as healthcare professionals, what are we going to teach them? We're going to teach them that unrestricted feeding at short intervals, at least 8 times per 24 hours, is a very good frequency to satisfy the baby's needs. A newborn can feed every 2 to 3 hours because it's very small. It's just learning how to swallow and suckle the breast milk. So every 2 to 3 hours, the baby can be put on the breast. But by the end of 1 week, the baby itself will have a routine, and every 3 to 4 hours, the baby will demand for breast milk. So all the pediatricians advise the mothers that you should breastfeed on demand. Okay, so a minimum of around 8 to 12 feeds per day. So we can tell the mother that if your baby is otherwise happy, not cranky, If the baby is vigorous in its activity, good activity, moving all the limbs, has a nice loud cry that is heard all across the hospital floor, and it sleeps well in between the fields. And also sometimes the baby sleeps longer at night and obviously gets up in the middle for feeds. And we know that the baby after birth for the first 7 to 10 days has a weight drop and then it gains weight. So we should tell the mother that she should ensure that after 10 days of life, the baby must not lose weight and the baby should go according to the weight gain according to the growth chart. And the baby is passing more than 6 times urine per day. So the mother should count that her baby is using at least 6 wet diapers. And the baby is passing yellow seedy stools and no more meconium. I told you the meconium is passed within 48 hours. And after that, the baby passes yellow, golden yellow seedy stools. And the baby does not have vomiting. So a nice, happy, vigorous baby passing good amount of urine and normal stools without vomiting and cries loudly is a good sign of a happy, well-fed baby. So these are all the points that you need to tell the mother to keep in mind so that she can ensure that the baby is well fed and that she's also producing breast milk. Because again, if she worries that she's not producing enough, if she's worrying that her baby is not feeding well, she will be having insecurities and her breast milk supply will also reduce.
Okay, ma'am. So almost 60 to 65% of people in India, they are lactose intolerant. So in case of lactose intolerance in infants, so what can be fed to the babies instead of milk?
Right. So the statistics that you told is about secondary lactose intolerance, which is seen in adults. So when we're talking about congenital lactose intolerance, it is very, very rare. So basically, lactose intolerance is a condition where the lactase enzyme, which is produced by the body to digest this carbohydrate called lactose, is absent. It is extremely rare, but when a child is born with congenital lactose intolerance, the baby or the infant will present with failure to thrive. That is, the neonate will present with frequent purges, excessive diarrhea, and it will have features of failure to thrive. So what is the treatment for this congenital lactose intolerance? There are various trials that are contemplating the use of lactase enzyme replacement in these neonates, and also formula which is lactose free can be given to such babies because breast milk is rich in lactose and it should be avoided.
Okay. So in the light of recent COVID-19 pandemic, we would like to ask you whether diseases such as COVID and others like hepatitis B, HIV, etc., they can be transmitted from mother to the baby. So how can such transmissions be prevented?
Right. So you have asked me about COVID-19, hepatitis B, and HIV, if I'm not wrong. Yes. So I think for it to be clear to all of you, we'll talk about it in separate. So if I talk about hepatitis B first, yes, mother to child transmission is possible. It is possible during pregnancy, during childbirth, and also postpartum via breastfeeding. So what can be done in such a situation? So once the baby is born, hepatitis B immunoglobulin and hepatitis B vaccine 0 dose is to be given to the baby strictly within 12 hours after birth. And the baby can be put on the breast, and exclusive breastfeeding and other WHO guidelines can be followed without any restriction. So this is about hepatitis B. Coming to the retrovirus, that is the HIV. So when I talk about HIV, there are different rules for different countries. So I will stick on to what we follow in India. So in India, because we are not yet a developed country, we are a developing country. So WHO as well as the Government of India guidelines state that the same rules be followed for HIV positive mothers and other mothers. So exclusive breastfeeding for 6 months and continuing breastfeeding for a minimum of 2 years, and especially at least for 1 complete year with age appropriate complementary foods. But what we should keep in our mind is that the mother should receive adequate antiretroviral treatment such that her viral load is under control, such that the transmission is reduced. And the baby is also given antiretroviral prophylaxis. It can be one drug or multi-drug regimen. The reason why in India we say that babies of HIV positive mothers be given exclusive breastfeeding is because the other alternative is formula feeding. And we being a developing country, we cannot say how much is the accessibility or feasibility to give formula milk, because formula must be purchased, must be diluted in clean, hygienic milk and fed in sterilized bottles. So only if the formula feeding is acceptable, feasible, accessible, safe, and sustainable. These are the rules given by WHO. Only if it is accessible, feasible, sustainable, safe, and affordable should the parents go in for complete formula feeding. They should never do mixed feeding in HIV positive mothers. It's either exclusively breastfeeding, which is the current guidelines, or exclusively formula fed. Why we don't advocate mixed feeding or completely formula feeding is because in India, the rate of respiratory tract infections or the diarrheal infections due to unhygienic practices are more, and HIV being an immunocompromised state, there is a high risk of infant mortality. So that is the reason we say exclusive breastfeeding, because I told you it has so many benefits. Now coming to COVID-19, you all would have seen day in and day out about COVID deliveries and how the mothers are feeding their babies. Exclusively breastfeeding is practiced in COVID-19 positive mothers too. Yes, the only thing is the mothers must be double masked, and if possible, they have to wear gloves, and they have to practice the same hand washing techniques that we tell for the general public. You know that COVID positive treatment is basically symptomatic treatment and adequate hydration. I told you again, breast milk is 88% water. So breastfeeding the baby is the perfect hydration that the mother can give the baby. So there is no restriction to breastfeed the baby. Yes, if possible, after the baby is breastfed, the baby can be taken care of by another caretaker till the mother recovers, and then she can again take the baby. But she has to remember to change the mask and change the gloves and wash her hand each time before breastfeeding the baby. So the same hygienic practices must be followed. So these are the ways the mother can reduce the transmission of these transmittable viruses to the baby.
Okay. So how can baby-friendly hospital initiative promote and support breastfeeding?
Great. Breastfeeding hospital initiative is one of the most, life-changing policies that were initiated with WHO and UNICEF with regards to mother and child health. So this was, this initiative was taken in 1992, and it gave 10 different steps to promote breastfeeding in hospitals. So baby-friendly hospital initiative is to be taken by all maternity hospitals such that they promote, protect, and support and sustain breastfeeding. So what are those 10 steps? We will be seeing it in short. So it says that every hospital must have a written breastfeeding policy. All the healthcare providers or the healthcare staff associated with the hospital must be well versed with that policy, and they should implement the policy. All pregnant women, and remember I say pregnant women, that means the education for breastfeeding must start right in pregnancy. So all breastfeeding women must be educated about the benefits of breastfeeding. The mother should be encouraged to breastfeed her baby as early as possible after birth, within 30 minutes of birth. The mother must be practically taught the best way to breastfeed her baby. The mother should be encouraged not to give any other food or no pre-lacteal feeds before breast milk. No artificial teats or pacifiers or formula milk must be advertised, or samples should not be given to the mother. The mother and the baby should practice rooming in. That is, 24 hours a day, the mother and the baby are together, either co-sleeping on the same bed, or the mother is on the bed and the baby is on the crib right next to the mother's bed. The mother must be encouraged to practice on-demand breastfeeding. And the last 10th point, which is very important, is that at discharge, the mother must be referred to breastfeeding support groups, such that she can carry on the journey of breastfeeding with the help of fellow mothers who are also breastfeeding and also lactation counselors. So breastfeeding hospital initiative, along with these 10 steps to encourage breastfeeding, it also states that the hospital and the healthcare providers must educate the mother about ORS, that is oral rehydration salts, in case the baby has diarrheal diseases, immunization, and also the adequate growth, weight gain, and the milestones of the baby. So this ensures that a baby-friendly hospital will, help the mother in the overall development of the baby.
Okay, ma'am. So you have already mentioned about temporary contraceptive option. That is, can one depend on lactational amenorrhea as a temporary contraceptive option?
Yeah. So lactational amenorrhea is a temporary contraceptive, but remember, it is not fail-proof or it is not fail-safe. Yes, it does fail. So if you ask me, there is 98% efficacy of lactational amenorrhea if the mother exclusively breastfeeds for the first 6 months after delivery. Excuse me. So we know that lactation involves increase in the secretion of prolactin. So prolactin is a hormone that inhibits gonadotropin releasing hormone, which in turn reduces the secretion of follicular stimulating hormone. So if the follicle stimulating hormone, or FSH, is not secreted, the ovaries don't develop any follicles. So follicles don't develop. In turn, the follicles have to secrete estrogen. So there are no follicles, there is no estrogen. So the estrogen level does not rise. When there is no estrogen level rise, the luteinizing hormone levels do not surge. So when there is no LH surge, there is no ovulation. So breastfeeding causes anovulation, and anovulation leads to amenorrhea. So this is the mechanism how there is lactational amenorrhea. This is not a fail-safe method, I told you, because we see so many women who conceive even before they get their periods post-delivery, because they would have ovulated before even they got their menses, and they would have conceived at that time. So it is very important that they use another method of contraceptive such that they don't conceive, because breastfeeding also ensures that there is adequate spacing in between the babies. So what a few things that we need to remember is that the menstruation comes again, that is, the women resume their menses on an average within 10 to 12 weeks post-delivery in 80% of the cases. And by 4 weeks postpartum, a non-breastfeeding woman undergoes ovulation. And by 10 weeks postpartum, a breastfeeding woman can ovulate. So if I am advising a contraceptive for the mother, I will ask her if she is breastfeeding or not. If she is not breastfeeding, I will tell her to use a contraceptive 3 weeks postpartum. And if she is breastfeeding, I will tell her or advise her to use contraceptive 3 months postpartum. And what is the best contraceptive? Not lactational amenorrhea, but progesterone only pill, that is POP, also known as the mini pill. Progesterone only pill is a best contraceptive that we can give for breastfeeding mothers, because combined oral contraceptive pills has estrogen, and estrogen component inhibits breast milk secretion, and we don't want that. So only progesterone, only pill is given to the mother. Another method is postpartum intrauterine contraceptive device, also known as PPIUCD, which can be inserted within 48 hours after delivery or after 6 months postpartum. So these are the other methods that the mother can use as a contraceptive. As always, the male partner can use male contraceptive to prevent pregnancy.
Okay. So, ma'am, just like blood banks all around us, now we have breast milk banks too. So, what is the role of breast milk bank?
Yes. So this is a new term for all of us, actually, breast milk bank. Am I right? But that's not the case, because right from the various previous generations, you would have heard stories. My grandmother would tell stories that she breastfed her children, her nieces, and her nephews. You would have heard of that practice. That is basically nothing but wet nursing. So what I mean by wet nursing is a person breastfeeds her children as well as the others in the family. But now what we follow is a technologically advanced version of breastfeeding. So we don't talk about sharing a breast, or we don't talk about door-to-door delivery of breast milk. We talk about hygienic storage practices of breast milk, and to donate this stored breast milk to babies in need. So babies who have unfortunately lost their mothers during the childbirth process, babies who are in need of breast milk and the mother is not able to produce enough, babies with known immunological deficiencies, babies with allergies, or babies who had to undergo a certain operative procedure, and to aid in post-op recovery, donated breast milk can be used. Or, as I said, sometimes in twins and preterms also, the NICU neonatologists will ask for it. WHO says that the first best thing that you can feed the baby is direct breast milk. The second is express breast milk from the mother. The third is donated breast milk. Fourth is commercial formula, and fifth is homemade formula. So you know that this is a descending order in which we prefer to feed the baby. So breast milk banks, what do? They screen donors, and a donor is a woman who is free from communicable or infectious diseases, is seronegative. She's a lactating woman feeding her baby and also having surplus breast milk that she can donate. If she is seronegative and all her blood tests are negative, if she is having sexual relations with a partner who is not at risk of HIV or HBsAg or at risk of other sexually transmitted diseases, she can be an ideal donor. She can donate breast milk, freeze it. She can express breast milk, freeze it, donate it to the breast milk banks. The breast milk bank will screen that breast milk stash for other diseases. They will also store it, and they will heat treat it or pasteurize the breast milk, and they will refreeze it, culture it, and make sure it does not grow any organism. And once it is tested negative and tested fit for delivery, only then the frozen breast milk is taken, and the breast milk bank will issue it to the neonatologist or the NICU who is ordering the breast milk. I told you there is no door-to-door delivery. It is only via a registered breast milk bank via a hospital. So donation, screening, pasteurization, freezing, and distribution of breast milk is done with the breast milk banks. This is a very great initiative which is seen in all cities in India, almost all cities in India, to reduce the neonatal and infant mortality.
Thank you so much, ma'am. So we are done with the question and answer. So I hand over to Pavan for the further doubt session from the audience.
Yeah, thank you, Gopika. Guys, you can post your doubts in the chat box so that we could address you the doubts. The first doubt was, you have said we can start the breastfeeding from the birth of the infant. So till how many days we can continue the breastfeeding? That is a limit, like 6 months. We need to have the exclusive breastfeeding, or even a year we carry over the breastfeeding?
Yeah. So we initiate breastfeeding immediately after birth, exclusive breastfeeding without any other top feeds, with only medicines or vitamins, which are medically indicated to be given till the age of 6 months. After 6 months, age appropriate complementary foods must be introduced, and the primary source of nutrition till the age of 1 year is breast milk. After the age of 1 year, breast milk is to be continued, and it has profound, I told you, psychological, immunological, and neurological benefits that are seen up to the age of 6 years. So WHO says that minimum of 2 complete years, the mother has to breastfeed the baby, and she can breastfeed the baby even after that, depending on hers and her baby's willingness. We have seen mothers who breastfeed the babies till the age of 6 years and 7 years. That is known as term feeding or extended breastfeeding.
Okay. Thank you, ma'am. So we could breastfeed till the mother and the babies.
Yes. Yeah. Perfect. Yes.
Interest. Yeah. So my next question is, we are seeing in India, we promote a lot of food. So which food it's better to be taken by a pregnant woman to improve the quality of the breast milk?
Yes.
Maybe from the prenatal to the till she completes her breastfeeding period.
Yeah. Yeah. So we should ensure a complete balanced diet with the extra calories that the mother must take during her pregnancy. So during pregnancy, we know that the mother should be supplemented with around 350 to 500 kilocalories per day addition to her normal diet. During breastfeeding, the mother must be given around 700 to 750 extra calories per day, because ideally she is feeding herself as well as her baby. So she should be given a well-balanced diet. There are few substances or items in our kitchen that promote breastfeeding. So you can tell the mother to include a lot of fluids. The first thing that we would tell the mother is to drink at least 4 to 5 liters of fluids per day, water, juices, anything. She can also include dry fruits, fennel, fenugreek, cumin seeds, ginger, garlic, and make any of the items that she's going to eat. If she's a non-vegetarian, she can eat lean meat, poultry, salmon. Vegetarians can include spinach, drumstick leaves, asparagus, any of these sorts which act as galactogogues. If she's not able to, increase her breast milk supply, she can consult her gynecologist, pediatrician, or her lactation consultant. And there are few polyherbal medications that are given to the mother to increase breastfeeding, and also drugs like metoclopramide can be given.
Okay, ma'am, that's well said and defined. So my next question is, ma'am, whether it's advisable for the pregnant woman to take COVID vaccine. So which type of vaccine we could take, and then when the neonates also will be given the vaccination. It's like under any research or for the COVID vaccination. Yeah.
Right. So COVID vaccine is something really new to all of us. We have never witnessed a new disease and a new treatment and a new vaccine being formulated in the time span of 1 to 2 years in our lives. I don't think any of us would have imagined when we were studying our textbook that we will see a new disease come up, a new treatment methodology come up, and a new vaccine being synthesized and produced in our lifetime. Right. So this is a very new topic. Yes. COVID-19 vaccines. Yes, there was a lot of confusion whether lactating women, pregnant women can be taken the vaccine. Now we have a thumbs up and a green signal from all government and international bodies that lactating women, breastfeeding women be given the COVID-19 vaccine, be it Covishield, Covaxin, Sputnik vaccine, or even the Moderna vaccine, which is being introduced. So the lactating women can take any of the vaccines and they need not stop breastfeeding. They can continue breastfeeding immediately because the antibodies that the mother produces will be transferred via breast milk to the baby, and the baby will get immunity. Pregnant women, yes, American, Britain, as well as a few Government of India guidelines still state that pregnant women be advised the vaccine and they can take the vaccine, but an advisory is still working on it. So as obstetricians, we advise the mother to take the vaccine because there are few studies that show that there is placental transfer of the antibodies. And yes, after delivery through breast milk, there is transfer of the antibodies. And when you
Okay.
ask me about vaccination for neonates, in India, you know that more than 18 years, only the vaccine is being given. Yes, in other countries, they are doing trials in 12-year-olds and 13-year-olds. So let's wait and watch.
Sure, ma'am. Sure. So, guys, kindly give awareness to the public to get vaccinated. So that's necessary thing. Yeah.
Yes.
Even
As
now they
healthcare
started
professionals, all of you should educate all your relatives and all your kith and kin, because you know, in the last 1 or 2 years, I think all of you would have got at least 1 or 2 calls every week to ask for help. You know, I've got COVID positive. What do I do? Or, you know, I have this infection or I have this problem, but I can't visit the hospital because of the pandemic. So please give me treatment. So as healthcare professionals, along with giving treatment, you should also, you know, educate the people about the safety of the vaccines and how it is important. And they should not believe the myths that are going around, you know,
in the social medias and the environments. Yeah. Thank you, ma'am. Guys, our final question due to the time limit. Ma'am, can you tell us COVID positive mother feed her baby? Whether a COVID positive mother can feed our baby?
Yes, we discussed that in the questions itself. A COVID positive mother can feed the baby. Yes, I told you that she should wear a double mask, and the top mask must be changed every 2 to 3 hours. She should wear gloves. She should wash her hands before and after feeding. She should maintain all hygienic practices. She can practice rooming in with the baby if there are no other caretakers available. But if caretakers are available, she can take the baby for breastfeeding, and the rest of the taking care of can be done by other caretakers. But yes, if she is breastfeeding the baby, she should not be worried about the fact that she is transmitting the infection. She should be concentrating on the fact that she is transferring all the nutrients that the baby needs for overall development.
Okay, ma'am. Thank you, ma'am. Thank you for this session, and it's very informative. Now, I'm going to hand over this session to Shipra for vote of thanks. Thank you.
Thank you so much. Before Shipra takes over this, I would like to thank Pawan and the whole team of Professional Helps and also IMA MSN for this great opportunity. And this topic is really close to my heart, and I'm very glad that I could, you know, shed some light on this important topic for all of you budding doctors. So I hope we all can make a difference, at least in one you know, mother and child's breastfeeding journey. So that small contribution of yours will help in the whole nation and the world's development in future.
Thank you so much, ma'am. It was a wonderful session, and we got to learn a lot today. And I want to thank everyone today who have been present here for this beautiful webinar. And on behalf of Indian Medical Association, Medical Students Network, Chettinad Hospital and Research Institute Unit, I, Shipra Shekhar, Vice President of IMA MSN CHRI College Council, extend a very warm welcome to all the people who have been gathered here for this webinar. I would like to express my greatest gratitude to our talented guest speaker, Dr. C.S. Namita ma'am, and for taking her precious time and collaborating with us for this interactive session despite the pandemic. And also we would like to thank ma'am for the demonstration as well, for how to latch the feeding of the baby and everything. And it was a very interesting one. Like normally we don't get to see these things, but we really thank you, ma'am, for bringing such innovative ideas to create awareness for this week, for this breast awareness week. And also we would like to tell that ma'am has her interesting page on her Instagram, followed by @OBGtastic. We all of you guys are welcome to follow her page and go through the information she has been provided for all of us. Please go through that. And we would like to also thank Professional Helps, the organization who has teamed up with us to who took the initiative as well with us to do this event. And especially I would like to thank our moderator, Ms. Gopika, how she had beautifully put up the questions to our guest lecturer. Very, very patiently she had, one by one, she cleared out the queries we all had all these days. Also, we would like to thank Mr. Pavan and Sriram, who also took the time to put forward the questions asked by the audience. Also, we would like to thank Indian Medical Association for giving us this opportunity to represent this beautiful organization as well as our college, Chettinad Hospital and Research Institute, Kelambakam, Tamil Nadu. And thank you, IMA, for inspiring and encouraging us for this initiation and for this creating the platform for us to, for the students to come up, collaborate with the teachers, and then give this beautiful information like every month. Anything, something new. This is something off track the normal online and offline classes. So, and also we would like to express our heartfelt gratitude, especially for the esteemed delegates who are present here, the faculties and the friends, everyone who came here to be a part of this webinar. We are very much thankful for all of you guys. And lastly, I would like to thank this organizing committee of the CHRI unit. I would like to thank Ms. Aditi M., the Joint Secretary, Ms. Nikita Manali, General Secretary, Ms. Karshini Kumar, Chairperson, Ms. Nilofa Ishrat, the Executive Council Member of the CHRI Unit Medical Student Network, Indian Medical Association, for working so hard to make this webinar a great success. Also, we hope to see all of you once again for the upcoming events in the future. Thank you everyone once again for making this event a great success. Thank you so much, ma'am, for coming up here and teaming up with us. We had a wonderful time with you, ma'am. Thank you so much.
Thank you so much. I'm looking forward to more such events. So let's learn together.
Definitely, ma'am.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you, everyone.
Thank you, ma'am.
Thank you, ma'am.
Thank you. Thank you.